Good afternoon, everyone, and welcome to the Multicultural Media Online Forum, here hosted by the Multicultural Health Communication Service, Multicultural New South Wales, and New South Wales Ministry of Health. Thank you very much. I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service, and on behalf of all the services, thank you for joining us today. We have, of course, our multicultural ministers, Minister for Health, Brad Hazzard, Minister for Multiculturalism, Natalie Ward, and Deputy Chief Health Officer, Marianne Gale, Dr. Marianne Gale here for us. We'd like to acknowledge the traditional owners of the land from which we are here all meeting today. And of course, we'd like to please remind you to keep yourselves on mute as we listen to the updates from our ministers and from Dr. Gale. And of course, also just reminding you that we're keeping our masks off just for being able to express ourselves and for those who are hearing impaired and also have a need to lip read for them to for us to deliver our messages. So let's start with Minister Ward. Thank you very much, Minister Ward. How are you?
I'm great, Jesusa. Great to see you. Thank you very much, everybody. Thanks again for coming to this important weekly forum. We do appreciate all of you coming together. I also acknowledge the traditional custodians of the lands and waters on which we each respectively meet, and acknowledge elders in each of our communities and thank them for their important work. I just wanted to say this week that I've spoken often of the importance of communicating with our religious and community leaders, and I continue to hold daily meetings with them. We're speaking regularly and I'm getting that feedback. Listening to what they have to say and responding is a top priority for me and for the New South Wales government. Those leaders have constantly and told me that vulnerable people need more help. That's been a really clear message from the outset, and we've listened to that. We've heard that they need more support for those grassroots organisations. So Jess, if I may, I'd be really delighted to make an announcement today that the New South Wales government will deliver a record funding package worth $18.8 million to help vulnerable members of our community. This is our biggest funding commitment during this latest COVID outbreak. This will help on the ground community groups to get to our most vulnerable. I've spoken about that each week and how we want to wrap around our most vulnerable and get to every corner of our community, and we're doing that through these organisations. Among those that will assist are recent migrants, young people, and of course our seniors. It's just such an important initiative because we know that people are really struggling during this latest outbreak. We're hearing that in my one-on-one conversations and in our community forums. So this this package will help the grassroots organisations to deliver food relief, to deliver, promote vaccination, testing services, to provide that culturally appropriate support that we know is required for our caring for our diverse communities. It includes, Jess, a $13 million grants program to deliver that emergency relief through our NGOs, our not-for-profits, and our multicultural community organisations. And I'm just so grateful to them once again for delivering and helping us to get to each of those communities that they know so well. And also through our local councils, of course. Local community groups are also eligible to apply for the grants. They're up to $30,000 each to deliver those grassroots projects, supporting our vulnerable communities, and I'm so grateful to them. There will also be $4 million for ongoing multicultural communications. We know and recognise the critical role that each of you play in communicating those messages, and that includes the interpreting and translation services to deliver those critical health messages. So thank you to our wonderful translators and interpreters who are doing such important work around the clock behind the scenes. And that's on top of the $4 million we've already allocated to ensure that we deliver those vaccination and stay-at-home messages to all areas of our wonderful multicultural community. So I just want to say a heartfelt thanks to you, our wonderful multicultural media, for partnering with us, for walking alongside us in this journey. We've spoken each week about this, but ensuring that those messages get through is absolutely critical. Just also, I'd like to let you know that I will be sending a message from the Minister column every few weeks to describe our multicultural communities and what the New South Wales government is doing to support and assist and partner with them. So the first column should hit your inbox in the coming days. We're just madly tidying that up and editing that. And I'd encourage you to run that if you feel it's appropriate in your publications. I would welcome that. We really want to recognise the amazing work that's being done in each of the communities. Also, getting people vaccinated, staying at home and complying with the public health orders remains our critical pathway out of this pandemic. As I say, the best vaccination is the first vaccination. The first one you can get is going to protect you. And having those important conversations with our loved ones, we know we've spoken about that before, but your family and your friends, the people most important to you, having those conversations about why a vaccine is so important and why getting it as soon as you can is so important. Please don't delay, please do that today. For many people, this can be a confronting topic. It can be a difficult one, but we must confront it. We must have that conversation with those that we love. So I just want to acknowledge the work being done by our translators and interpreters. It's incredible, more than 2,300 translations of specific responses and health information, including the stay-at-home orders. And that's available in almost 60 languages. I'm so proud of the team there that are doing that. There's a terrific response to the live interpreting of the 11 a.m. Our Australia First 11 a.m. in 6 languages of the COVID news conference. I'm really grateful to our interpreters, and that's in Arabic, Syrian, Mandarin, Vietnamese, Khmer and Cambodian. So it's wonderful work being done there. And I've told there's been more than 700,000 views since it began across Facebook, Weibo, WeChat, Twitter, which is just amazing. Of course, SBS is broadcasting in Arabic and Vietnamese live on SBS TV and SBS On Demand. So I'll finish up there. I just want to say it's important that we really communicate as we deal with this pandemic, that we are acting on that feedback. I am listening, and I really appreciate the opportunity to have these question sessions live each week so that we can answer questions and get feedback from you and respond as quickly as we can. Thanks, Jess.
Thank you, Minister Ward. Thank you for that announcement. And Minister Hazard, how are you today? Minister Hazard is joining us online.
All the work the multicultural media have done to get the messages out to obviously the multicultural community. I think Minister Ward has said it all, so I might move straight to when you're ready, Jess, with questions and answers.
Thank you, Minister. And Dr. Gale, how are you today?
I'm very well, thank you, Jess, and good afternoon, everybody. Nice to be here again. Nice to see you all. Look, for me, really the same key messages that we've talked about before, and clearly the case numbers are higher than what we'd like them to be, and we certainly want to see those numbers stabilised and on the decline, but also being realistic. We're conscious that we may still see increases, and that's why it's really important for us to be able to get on top of this very transmissible Delta variant, that people do follow the public health orders, that people do come forward for a vaccination as soon as possible, and that you do get tested even if you have the mildest of symptoms. And that's just critical that we all do our absolute best, because this Delta virus is so transmissible and spreads so easily in households, spreads so easily from person to person. So it's really critical that each of us play our role, reflect on those issues for ourselves, talk to our families and friends about it, because it's absolutely important that each and every person in New South Wales follows that advice, gets tested, gets vaccinated, if we're to get on top of this. Thanks, Jess.
Thank you, Dr. Gale. We'll go now to the questions from RT Banga from Desi, Australia. As per the current vaccination rate, when do you think we will reach 80% of the population vaccinated with both jabs? Minister Hazard?
Look, first of all, I just say that's very much dependent upon the community coming with us on the journey. And if everybody continues to come out and get vaccinated at the current rate, then we expect that it would be somewhere in the middle of November or so. I have to say that some of the communities that have been most challenged in this difficult time, particularly in the southwest and western part of Sydney, have actually very much come to the fore. They've risen to the challenge, and we're seeing the vaccination rates go up far more quickly in areas like Blacktown and Fairfield, and generally in that western and southwestern area. So thank you to all of you. And if we keep that up, I think we might have close to 80% sometime in November.
Thank you, Minister Hazard. There's a question here, Dr. Gale. How many ICU beds do we have in New South Wales?
Thanks, Jess. Look, I don't have the exact number, but what I do know is that our ICUs are extremely well equipped and very well prepared to care for anybody, whether that be people with COVID or people who need ICU care for any other reason. There's been a lot of planning and preparedness work that has happened in our ICU services across the state since the very beginning of the pandemic. So looking to make sure that staff are trained, that we have enough ventilators for people who might need them. And also we're very lucky in New South Wales to work in a system that is very well networked. And that means that ICUs in the Sydney area, for example, are well able to support colleagues in rural and regional areas. We have technology that allows telehealth, so for specialists in Sydney to be able to connect by video to rural and regional areas. And certainly we've got the ability to expand the current ICU capacity to meet the needs if required. But clearly we don't want to see that. Our ICU nurses and doctors don't want to see you in their ICUs. And that's why it's incredibly important that people get vaccinated, because we know that the 2 vaccines that we have are highly effective at preventing severe illness, at preventing hospitalizations, preventing ICU admissions and preventing death. So our ICUs are more than ready to care for people, but we really don't want to see you or your loved ones in ICU.
Thank you, Dr. Gale. There's a question here from Marie Ma, Vision China News. The COVID testing requirements for authorized workers in LGAs of concern who need to leave their LGA or local government area for work states that the employee need to have either their first vaccination shot or the workplace must implement rapid antigen testing. Most small to medium essential businesses do not have the scale to implement rapid antigen testing, and they have authorized workers who are not vaccinated. Can these authorized workers get the normal PCR testing instead? Dr. Gale and Minister Hazard.
I can start. Look, the really key message with all of this is the importance of being vaccinated. And there's a lot of opportunities for people in the community to get vaccinated. There are large state-run hubs which have capacity. We have a lot of Pfizer that's come in, and we really urge people between the ages of 16 to 39 who live in those 12 LGAs of concern to book in to get vaccinated. There are also opportunities through GPs, through pharmacies. So all authorised workers have multiple opportunities to get vaccinated, and especially if you're in that age group in those 12 LGAs, that's really the critical thing, to come forward and get vaccinated. RAT testing or rapid antigen testing is there for workplaces, and we're particularly working with industry around those high risk settings to implement RAT testing. But the very key message and the best thing that we can all do is go forth and get vaccinated.
Thank you, Dr. Gale. There's a question here from Pawan Lutra from Indian Link. Mr. Hazard, over the weekend, reports have emerged that over 200 children below the ages of 12 were detected with COVID-19 virus. This is indeed worrying, as this age group is not in the line for vaccination yet, and no decisions have been made by ATAGI on this. What can you share about this concerning trend? Minister, sorry, you're on mute. You're still on mute, Minister. Sorry, there's some technical issues that we're experiencing. Dr. Gale?
Perhaps I can say a few words about the cases that we're seeing in children. Clearly, with this Delta variant, we are seeing a considerable number of children become infected with COVID-19. And we see that we have households, and we know that with this Delta variant, once it enters a household, everybody in the household is highly likely to become infected. And we know in some of the areas at the moment where we're seeing cases is that we have a lot of young children who may live in households. And so we are seeing children become infected. We're also seeing transmission occur in early childhood settings where children are getting infected from adults or other children in those settings. So clearly we are worried about infections in children and reducing transmission. We're watching closely the advice of ATAGI about being able to vaccinate younger children. And certainly, I think there's going to be more to be seen in that space in the very near future about making vaccination more widely available to a younger group of people. And we know that there's certainly evidence emerging about vaccinating even younger children under the age of 12, but it would be premature at the moment. And as my understanding is that the evidence is still being generated about the safety and the effectiveness of the vaccines in younger children. But certainly we're keen that as soon as vaccines become available to be used in younger children, we'd be absolutely keen to pursue that in New South Wales.
Can I add something, Jess?
Yes.
Yes. This is why, because there is at this point no authorisation from the regulatory bodies here in Australia to vaccinate people under the age of 12 or under. It just makes it all the more important for each of us as family members, as people who are older, to get vaccinated. Because if we get vaccinated, then what we're doing is, to a great degree anyway, ensuring that the virus won't transmit through our household to our younger children. So it's a very, very strong reason to go and get vaccinated. And can I add just one other thing? We were talking about authorised workers a little while ago. There are currently 200,000 vacancies at our vaccination hubs, particularly at the Sydney Olympic Park, for authorised workers, including people who work with people who are disabled, people who work with young children, to book in and go and get vaccinated right now for the next 2 weeks through till September the 5th. So get onto the website and make your booking and go and have your first vaccination. And I remind everybody that if you have the vaccine, either one of them, roughly 2 to 3 weeks after your first dose, you have around about 70% reduction of likelihood of going to hospital or of getting very sick, indeed of dying. So it's worth going now while we've got those 200,000 vacant bookings.
Thank you, Minister Hazard. A question for Minister Ward by Indian Link. Minister Ward, media reports have written about the increase of neo-Nazi and white supremacist chatter in the recent months. As we are aware, these xenophobic institutions build up steam around societal disruptions. The COVID-19 crisis has seen a rise in a number of street attacks on Australians of Asian backgrounds being publicized on social media in the mainstream. A comment here, we would need Multicultural New South Wales to be in the front foot of this rather than to wait for reporters.
Absolutely. Thanks, Jess. And thank you, Pawan and Indian Link, for all you're doing. Your Get the Jab message is amazing. And I'm very, very grateful for all the communications that you are doing. Yes, it's quite appalling. There is no place in our beautiful, harmonious, multicultural community in New South Wales for this kind of behaviour. We will not tolerate it. And, now more than ever, unity is the key to our pathway out of this situation, and unity is absolutely important. We have the privilege of enjoying such a wonderful, harmonious community here. Our multicultural community pulls together, and we've seen that overwhelmingly. So I condemn that dreadful action, and we will do everything we can. We have a number of programs in Multicultural New South Wales to stop the hate. Those programs can be seen on the Multicultural New South Wales website, but we're proactively countering that. I want to thank those leaders who've participated in that and are working on that Stop the Hate, particularly online, Stop Those Pathways. So really appreciate the comment, and we are well aware of it. Thank you.
Thank you, Minister Ward. Minister Hazzard and Dr. Gale, there's a question here. Where should people go for accurate information and booking for vaccinations? There have been reports of scams from GPs and WeChat or online that are charging for vaccination. Minister Hazzard?
Oh, well, the first thing I would say is that you shouldn't have to pay for a vaccination. It's absolutely free. And of course, you can go to a local pharmacy in your area. Many of them have the COVID vaccines, or vaccine, the AstraZeneca. Go to your GP. Many of the GPs have Pfizer or AstraZeneca, and of course, any of the state hubs. So if you go on to nsw.gov.au, that will take you into the booking system. So nsw.gov.au, and you can make your booking.
Thank you. There's a question from Ling Kwang of BQ Weekly. Are we following the right model like UK or Israel? As we can see, data shows nearly 60% of hospitalized COVID-19 patients in Israel are fully vaccinated, or Australia and New South Wales should have their own way to managing the pandemic situation. Dr. Gale?
Look, I think the path that we're on in New South Wales is absolutely necessary to control the spread of this Delta variant. And of course, we always look overseas to learn from experience overseas, and to understand what things may or may not work here locally for us. But I think what is very clear, and what we understand in relation to the Delta variant, is that we need a suite of actions in order to control the levels of spread, and most importantly, to reduce the death and the serious illness caused by COVID. And to achieve that, that is why we have the settings in place that we have, which is why we have the restrictions that we do, which we recognise are tough, and they're tough on families, they're tough on communities, they're hard. And I want to say a big thank you to the communities of New South Wales, and particularly the communities in those 12 LGAs that have been sticking it out for a long time now, and we realise that's really difficult, but it is necessary to control the spread of the Delta variant. And it's also why we need the very important tool of vaccination on top of those initiatives, because it's absolutely important to have vaccination as an additional tool to prevent severe disease, to prevent hospitalisations, to prevent deaths. And we know that that is incredibly important as another tool against the Delta variant. And we know from experience overseas that all countries, all jurisdictions that have been affected by Delta are struggling to contain it. And the settings that we have in New South Wales are necessary to give us a chance to really get on top of this Delta variant and reduce the harms that it may cause in our population.
Thank you, Dr. Gale. There is a question here about language support. Minister Ward, a question about what kind of support can we have for recognizing the Asidi language or Asidi support for the community?
Mute. There we are. Can you hear me now?
Yes.
Yeah, terrific. Thank you. Yeah, it's a great question. And I thank the Yazidi community for their important work with communicating the health messages. We always welcome feedback. We can always do more with each of our communities, and we're interpreting and translating over almost 60 languages now. And we continue to communicate those vital health messages. And there are further resources, of course, on the New South Wales Health website, and there's translations available. And of course, we have 24-hour translators. But I'm also particularly proud of the Multicultural New South Wales Interpreter Scholarship Program, which we're really proud about, because that nurtures the next generation of qualified interpreters. And I'm really proud to say that many of our scholarship participants have Yazidi backgrounds and speak those languages. So they're coming through, and we really appreciate the input of that community.
Thank you, Minister Ward. A question from Marianne Murad. The original health advice for the Pfizer vaccination is to be given 3 weeks apart, but now the wait is 8 weeks. Can you explain the inconsistencies? Dr. Gale.
Thanks, Jess. The advice around the vaccination is really about, in any given context, balancing what are the relative benefits of timing. And at this present time, with the levels of transmission of the Delta variant in the community, it's very important for people to get a first dose of vaccine, because, as we've heard, even just one dose provides a really high level of protection against severe disease, including hospitalizations, ICU, and death. So enabling as many people as possible to get that first dose in is absolutely critical, because we know that that is incredibly important. We know that spacing the doses, so from more than 3 weeks and beyond, is absolutely safe and is absolutely effective. And our priority at the moment is using the vaccines that we've got to get as many people that first dose of vaccine as we possibly can.
Thank you, Dr. Gale. Minister Hazard, there's a question from Fred Zhang from Sydney Today. According to other countries' experiences, there would be a surge in infection once restrictions are lifted and hospitals would face extra pressure. Is our health system prepared for such a situation?
It is, but we're aiming to get much higher vaccination rates in any case than most other countries around the world. And we've seen what's happened in countries like the USA and Israel and so on. We aim to get up to at least 80%, but if we can get more, that would be even better. So if we can get 85% or even 90% of the community to have both vaccinations, then that's going to keep those individuals safe, it's going to keep their families safer, and it's going to keep the community safer. As to the health system is a very, very big system. It's a network system, so we have hospitals that work each with the other. And although there's some pressures at the moment on, for example, Westmead Hospital, those pressures are not as bad or not as great in other areas. So there are staff coming from those other areas into helping out with Westmead. Essentially, at the moment, though, we do have pressures, and we have pressures because Westmead, for example, Westmead Hospital and Blacktown Hospital are sitting in the epicentre, in the very centre of where we have an awful lot of cases. More than 900 positive cases last night, and more than 80% of all of those cases, yet again, and it's been this way now for the past 3 weeks, were in southwestern Sydney and Western Sydney. So it's to be expected that a hospital that is a major hospital like Westmead would have some pressures. On top of that, we've also had staff taken out of Westmead to go into our mass vaccination centres. So that also presents difficulties. But there's no question that our hospital system is a very resilient one. It's a very good one. And I'm quite confident that we will manage the situation as we proceed. Earlier, someone asked about the number of intensive care beds and ventilators. Can I say, in March last year, we had roughly about 500 ventilators. So that's, if you go into an intensive care unit, you may or may not need to have a ventilator to help you breathe, but we had about 500. Over the course of last year, the government prioritised that, and we now have more than 2,000 ventilators available if we need them. So we're nowhere near that situation at the moment. I think in the Westmead Hospital today, there are 23 people who are in the intensive care unit and 121 people in the general wards. So whilst it's busy, it's certainly not likely to cause any major concerns for us in the near future. But I would say again, go and get vaccinated. Stay home if you've been asked to stay home, and get vaccinated. If you get vaccinated, you're saving yourself, your community, and of course, your family, most importantly.
Thank you, Minister Hazard. On a positive note, people have been saying the congratulations or a well-achieved 6 million target that's been achieved by New South Wales Health with the vaccination. We have one last question, and this is about if any job seeker appeared for a job interview outside their LGA, would they have to apply for a permit? Are there any further requirements? Ministers, would you like to answer that question?
If you're leaving as an authorised worker from the LGA, then obviously you have to get you have to comply with the rules. And at the moment, you can't just go outside the LGA for a job interview. So I'll raise that issue with our team and ask what we might be able to do and put some information up on the Service New South Wales website.
Thank you very much. We have run out of time and there have been a lot of questions. So what we'll do is we'll gather your questions and try to reply with some answers for you. So thank you. It's been over a month since we started this Multicultural Media Online, and we're really, really happy that you've been able to join us in this journey. And thank you so much for the Multicultural Media. Any last words from Ministers Hazard, Minister Ward, and Dr. Gale?
Just a big thank you to the Multicultural Media. You really do an amazing job getting the message out to the various sections of our incredible community. So just thank you.
Same from me. Thank you. We can't do this without you, and your messaging each week is critical. And thank you for the feedback. Please keep it coming. Multicultural New South Wales and I are here to listen, and we really appreciate that responsiveness, because then we can act on it straight away. So thank you.
Dr. Gale.
Thank you. Just to echo those words, we really value the work of the multicultural media and all multicultural organisations in connecting with the community. We know that people need to receive information and advice and be engaged with in lots of different ways. And, you know, many of you may know that, know how to do that better than we do. And so, you know, your support and your engagement has been absolutely critical, and a big acknowledgement to the work that you do. So thank you.
And thank you very much again from all of us, New South Wales Health, from Multicultural Health Communications Service.